An eye doctor in the Jackson Metro is offering a groundbreaking new treatment to correct your cataracts. Joining us now is Dr. Elizabeth Mitchell of the Eye Group of Mississippi. Dr. Mitchell, thanks so much for joining us today.
Melanie, thank you for having me on.
Tell us about this new treatment for cataracts. This is really groundbreaking.
It is. For many, many years, as patients develop cataracts, the lens in their eye starts to get cloudy. They don't see as well as they did. They would come in for cataract surgery, and that would mean take the cloudy lens out of the eye and put a nice clear implant lens in. And very frequently, we can achieve good vision, but most of the time, they still have some residual prescription. So they might still need glasses if they're still a little nearsighted or farsighted, or maybe some astigmatism. What's so special about the lens we're talking about today is the fact that once you put it in the eye, it actually can be adjusted. So it changes the prescription of the implant after it has gone in the patient's eye. So we typically give them a few weeks to heal, come in, do a measurement to try to find out if there's any residual prescription, seat them in front of a light delivery device, and it changes their prescription and enhances their vision in many cases to 20/20.
That is fabulous. So the need for the extra glasses or the readers or something can typically go away if
markedly reduced, yes.
Wonderful.
So what they're seeing with their studies is that their patients are almost 2 times as likely to achieve 20/20 by using the light adjustable implant lens than if they're using a regular implant lens. And that's talking primarily about distance vision, of course, but a lot of the patients can achieve a great deal of near vision just by making adjustments in the implant itself. So after they heal, if they're loving their distance vision and we want to incorporate a little bit better up close vision, we can change the implant just a little, give them that near vision and see how they like it.
My goodness, who's eligible for this new treatment?
Well, that's a good question. First of all, patients need to have enough cataract to be causing some difficulty with their overall vision. Once you qualify, most every patient would be a candidate for this lens with a few exceptions. If your pupil won't dilate well enough to be able to do the treatments, then that might be an issue. If you're on a medication that makes you more sensitive to sunlight or UV rays, that could be an issue. And then rarely if patients have had things like HSV keratitis, infections on their cornea, that might be an issue.
All right. How can people get this new treatment? How do they go about getting it?
Well, we're very happy to say that at the Eye Group of Mississippi, we're the first office in the entire Middle Mississippi area to be offering the RX site treatment. And so if they call 601-985-9120, or if they come to the website, which is eyegroupms.com, it shows them a lot of information about the different types of cataract procedures and gives them a link so they could get in touch with us.
Wonderful. All right. Elizabeth Mitchell. Dr. Mitchell, thank you so much for being with us and telling us about this new treatment for cataracts, which, really does affect so many people, particularly as they age.
More and more. And Melanie, thank you for the time to talk about this new innovative material.
Thank you.